Hello and welcome to the 19th episode of Educhat with Dr. Sujit. And guess what? This time we have got like more than 50 questions on different social media from all of you. And I understand that as a practicing dentist, so many of you want solution to your questions, to your day-to-day problems and challenges that you face in your practice. But while selecting your questions, we select the top 3 questions every time, and the only criteria of selecting the question is if it is going to be beneficial for maximum number of dentists. So this time also we have selected 3 very good questions, right? And as you know, the person who asks the best question gets a free copy of my international bestseller book, New Age Dentalpreneur. So in this episode, I'm going to answer 3 questions for you, and today the voice of questions behind the camera is Tanvi. So Tanvi is going to ask the question. So let's start with the 19th episode of Educhat with Dr. Sujit. So Tanvi, what's the first question?
Dr. Salma Hassan has asked how to deal with relatives' patients.
Well, I can understand, Dr. Salma, your pain, okay, and I'm sure you're not alone, because whenever you have your very close friends or your relatives as patients, it is extremely difficult to deal with them, and because of multiple reasons, because of unreasonable expectations they have from you all the time. I'm sure you all will agree with this, that they want the best possible treatment at the least possible charges, or probably zero charges, free of cost, and at their convenient time. And the moment they enter in the waiting room, they don't want to sit in the waiting room, they want you to attend them first, that so-called VIP treatment. And on top of that, no matter how less you charge them, they are still not 100% happy, right? So it's a common problem, one of the toughest situations to handle for every practicing dentist, and all of us goes through this multiple times. The worst outcome about this situation is, in the end, you lose the patient, you lose money, and many times you lose relationships as well, because it's always very difficult. I have seen a lot of dentists, giving the discount, but under the name of you just give us the material charges. And these guys are so smart that they will just Google the material charges and they're like, okay, you have looted us, you have taken more money from us, whatever. Or on the other hand, even if you give discount, they are still not happy with whatever discount you give, because at the end of it, even if you have genuinely given them the entire discount, have not taken a single penny except the overheads and the charges, they will still think that you have earned something from them. And this is a common problem. And it's extremely difficult to deal and to satisfy such people. On one side, you cannot neglect or ignore them. You cannot say no to them for the treatment. On another side, it becomes really difficult, sometimes embarrassing, sometimes frustrating situation for you to handle it. So how to deal with it? And I think the best solution is this. Talk to them upfront about your normal charges and tell them whatever best possible discount you can offer to them. Make sure that you do not take money from them under the name of minimum charges or material charges. No. I'll tell you what. I have seen so many, so-called VIP people in the society, or rich people in the society, but having a very substandard dental work in their mouth. And I hope you understand where it comes from. Okay? So because majority of the times, as a practicing dentist, if you cannot charge them anything, but your overheads are same, your variable expenses are going to be there, and you land up doing maybe a PFM crown instead of a material-free crown, even if the person is affordable, but probably not willing to pay for the same. So my very frank suggestion is, talk to them upfront that these are different treatment options, okay, and you give your suggestion, your advice, which you think is best for them, what they should go for, and then you offer whatever discount you want. So those who are good, they will appreciate this and they will pay you happily. And those who expect everything free of cost, they will probably leave your practice. Honestly speaking, in both cases, it is okay. Okay, because instead of losing everything in the end, instead of landing up with a lose-lose situation, it's always better to create something which is at least win-lose, if not win-win. Right? So I hope, Dr. Salma, you got your answer. So Tanvi, what's the next question?
So Dr. Naveen has a very unique question, and that is, how do I get feedback about my behavior with patients from my staff?
Cool. So how to get feedback from your staff about your behavior with the patients? Very interesting. And Dr. Naveen, I tell you, the answer is very simple. You need to have conversation with your staff from time to time. Okay? Firstly, I must tell you this, that your willingness to ask or to get that feedback, when you ask this question, your willingness itself is a very positive sign. Because a lot of people have this feeling or have this nature that, I know it, I am the best, I know what to do. And how come my staff can tell me what to do and how should I do or how should I behave with my patients? Okay? They are inferior to me. They don't know things. I know it better than them and so on. But I'll tell you what, the moment you have this kind of behavior or the willingness to get the feedback from staff, that itself makes you a special person. Special in the context that you are willing to learn if something is going wrong. And that's a very nice thing. So congratulations for that. Now, coming to how to get that feedback. You need to have the conversation with your staff regularly. And the only way you can have the regular conversation with your staff, not just about the feedback, but for every single thing that can help you to grow your practice individually as well as collectively, is to conduct regular staff meetings. So in India, this culture is not very common. Staff meetings are not conducted very commonly or routinely. But if you go to the Western countries, staff meeting is a regular part or ritual of their day-to-day practice. So when you conduct staff meetings, you cannot just take their feedback about your behavior. You can take their feedback about the overall practice, about the overall experience, about what patient talk in the waiting room, before the treatment, after the treatment. You can ask them about how we can grow the practice collectively and so much. And not just that, regular meetings will help you to ensure that your staff is always motivated, always positive towards work. They know their role, they know their competencies. You can enhance their competencies, but all that can happen only when there's a conversation, right? And the best way to have a conversation with your staff is to conduct regular staff meetings. So through this question, I really want everybody who is watching this video to ensure that you start conducting the staff meetings in your practice. And you will get, you will be surprised to get few super powerful feedback from your own team members about not just your behavior, but how to take your practice to the whole new level, right? So wonderful. So let's go to the third question. Yes, what's the third question?
So doctor, our final question is from Dr. Cool, and that is, where to start a clinic, in a city or in a village?
Awesome. So Dr. Cool, you have this question that shall I practice in city or a village? And let me tell you something. I have answered a similar question in one of my YouTube videos before. So if you have not subscribed to my YouTube channel or if you have not watched all my videos, I want you to subscribe, like, share, comment, and at the same time put that notification bell on, because I don't want you to miss any of the powerful content that I create for all of you. And if you think that any of the YouTube videos on my channel is useful for any of your friends or colleagues, I want you to share that video to them so that it can help them to take their practices to the next level, right? So coming back to where you should practice, remember, every coin has two sides, right? And same applies to your question as well. The practicing in a bigger cities and practicing in any small town or village, both, it's like both of these scenarios have pros and cons. So what are the pros of practicing in city? Practicing in city, one of the biggest plus is the no upper limit. Yeah. So when you practice in city, your practice can grow to any level. If you know how to grow your practice by means of all 3M that I constantly keep on talking about, and that is marketing, soft skills, clinical skills, right? I always say that dentistry is all about 3M: marketing, management, and professional mastery. So when you practice in city, and if you work on all 3M's constantly, your practice can go places. There is no upper limit. Whereas in these small towns, the practice can get stagnated. Beyond a point, it's really difficult to increase the practice because of the socio-economic status of the people who stay there, right? The second important thing you need to remember, it takes more time for you to settle a practice in a bigger city as compared to the small towns. Because in small places, everybody knows everyone. Okay, so the moment you start practicing, like within a month, everyone in your town or village will come to know that, there's a new dentist or his son or daughter has started a practice there. So it's an advantage. It's a special leverage you get. In the cities, there are so many people. We are just one of them who get lost into the crowd. It takes a lot of time, efforts, money to make yourself visible, to create your brand awareness, then brand image, then to enhance your brand perception of you and your practice. It takes months to sometimes years to settle a practice in the city. Third thing, you need more money, whether it is for rent or your own premise. You need more overheads. Your overheads will be higher. Your staff salaries, your variable expenses will be on the higher side if you practice in cities. Whereas in the small places, all these expenses will be substantially lower as compared to your city practice, right? Fourth thing, if you practice in a good locality, okay, with good demographics in cities, you will be able to do all the high-end treatments, whether it is full mouth implant, whether it is laminates, smile designings, FMR kind of cases, lasers, whereas which is not going to be very easy in the smaller towns. Because on one side, people don't have the financial bandwidth. On other side, they don't have the dental awareness of that level. I'm sure somebody who is staying in Metro and Cosmo City will definitely go for maybe smile designing. But someone who is staying in village, works in the farms, they will definitely not come to you for smile designing treatment. So the kind of treatments which you can do also makes a difference. And the fifth is your profit margins. The profit margins in the small town practice will always be on higher side as compared to the city practice. Because you do high-end treatments in the cities, the cost is higher. Okay, the variable expenses are on the higher side. At the same time, your overheads are always on the higher side. So the net profit and the net profit margin especially will always be higher if you practice in the small town. So if you are someone who is more for, I should settle down very fast, I don't have, a lot of money, or I don't have patience, or I want to click my practice very fast, I should live with minimum expenses or something, then probably a small town or a village is a better place for you to start the practice. But if you're someone who is like, I'm willing to do the hard work, even if it takes years, I have the patience, I have the financial bandwidth, I can sustain, I can survive, I have that zest that, I want to do all the treatments, if not immediately, eventually, then probably the city practice will resonate to your nature more. So you are free to take your call depending upon what is, what's your personality, what's your behavior, what's your financials, and what kind of results you expect. Okay, your why. So I hope you got your answer. Now, with this, we come to the end of the 19th episode of Educhat with Dr. Sujit. So it's time to choose the best question. And the best question of the week is by Dr. Salma. I liked answering how to deal with the relatives or close friends as your patients. It's always extremely painful situation for many dentists, right? And I'm sure you will agree to me. So Dr. Salma, congratulations, you win the copy of my international bestseller book, New Age Dentalpreneur. Just hit an email at connect@sujitpardeshi.com and of course share your address in the email, and we'll be glad to send personally autographed copy of New Age Dentalpreneur to you. So with this, let's end the episode 19 of EduChat, and I'll see you in the 20th episode. Thank you.